I don't know how much more we can say about the influenza vaccine here on Healthcare Triage, but that doesn't mean we're going to stop. It turns out that repeated vaccinations may be even better than one. This is Healthcare Triage News. As we have covered in many previous episodes of Healthcare Triage, the influenza vaccine is tailored from year to year to match the current or expected strains. This means that sometimes it's a home run and sometimes less of one. Wouldn't it be great if last year's vaccine carried some protected effects into the next year? New study in JAMA Pediatrics. To the research. Researchers conducted a multi-season test-negative case control study in 4 outpatient clinics in the United States. They looked at kids aged 2 to 17 years who had a febrile illness seen by a doctor in clinic. The cases were kids with influenza-confirmed illnesses. The controls were kids who were tested and shown not to have influenza. The exposure of interest was vaccination history, both for the current season and for the season before enrollment. They got these data from the medical record or from immunization registries, which helps with some of the recall bias we'd otherwise worry about with case control studies. The main outcome of interest was the effectiveness of the vaccine after adjusting for potential confounders. These included sex, race, ethnicity, insurance status, high-risk conditions, time of year, and number of outpatient visits in the past 6 months. So lots of stuff. There were 3,369 kids in the study. Just under a quarter of them had positive tests for influenza. About half of the kids in the study had been vaccinated that season. But here's the thing. The vaccine efficacy was significantly better against one strain of influenza, H3N2 if you're interested, in kids who had gotten the current vaccine and at least one previous season's than in kids who had just been immunized with the current vaccine. There was even some residual protection from only getting a prior vaccination against influenza B. Look, I know we harp on this issue, but let's acknowledge that it's not all bad news. In the 2016 to 2017 season, it's estimated that about 60% of kids under 18 and 76% of kids 6 to 23 months were immunized against influenza, and that's a lot better than nothing. At no time in this study was there any evidence that repeated vaccination was bad. So let's put that myth to bed. Some people and some less well-designed studies have tried to sell that idea, and this study didn't show that at all. No study's perfect, and this study's no exception. There are still potential confounders here, including the fact that kids who are vaccinated repeatedly may be different than those who are not, because of their families, or lives, or something we're not measuring. This is a case control study. On the other hand, this study should also get props for its intensive prospective design. This kind of work is so hard to do from an observational basis because of confounding and the difficulty in measuring vaccine effectiveness without bias. This study could also look at multiple years of vaccinations, which many other studies can't. Bottom line, this study provides evidence that vaccinating your kids every year is better than not vaccinating them every year. It's more data in support of current policy and healthcare triage coverage. Act accordingly. Do you like the show? Always helps if you like or subscribe right down there. And another good way for you to support the show is a subscription service called patreon.com, where you, the viewer, can directly support on anything you like $1 a month. More if you like, but if you don't want to, totally fine as well. Go to patreon.com/healthcaretriage to see how you can help. We'd especially like to thank our research associates, Joe Sevitz, Crafty Geek, and Jonathan Dunn, and of course, our Surgeon Admiral Sam. As always, go to httmerch.com to pick up good healthcare triage merch, and my book, The Bad Food Bible, still on sale in stores.